Hello, hello. Good morning. Today is Saturday. Today is November 6, 2021. This is our usual Saturday morning yoga therapy class. This month and next month, we're going to have a Thanksgiving, Christmas, and I'm also in a process of moving my residence. So I may be missing a lot of classes, but today I'm here. I'm still in my home in Norfolk, Virginia. Today's topic is yoga therapy instead of medicine. What does it mean? We are actually presenting our experience and also our research to share with you. What we have noticed, a very simple practice of yoga as a therapy, which is basically adaptation of the yoga practices from a philosophy of yoga and the 8 limbs of yoga based on the patient's clinical condition. And if it is done regularly, a regular practice of a simple relaxation response and activation of the parasympathetic tone, our experience today is that the chronic lifestyle-related disorders like truncal obesity, diabetes, hypertension, heart disease, coronary artery disease, high cholesterol, dyslipidemia, we're seeing that all of our patients are slowly reducing their pharmaceutical support. They're having a better quality life, and their progression of the disease is a lot slower. Even some cases, we have a regression of the disease. As for example, myself, I had an open heart surgery. I had a significant triple vessel coronary artery disease about 20 years back. Today, I'm in front of you doing a daily practice of yoga, and I am disease-free, I'm healthy, I'm not on any medication, and I'm enjoying a quality life. So what practice do we do? It is such a simple practice, a lot of people even doesn't want to even accept it. First, we practice what is called a grounding. The asana, in fact, the word asana, we call it the internal and external alignment, but the original description of asana basically is a grounding. In Sanskrit language or Indian language, people say, okay, sit down in asana. That means grounding. So best grounding is able to sit down in the ground. If not, you can sit in a chair. Number one requirement, how to proceed with the relaxation response and parasympathetic activation. Keep your spine straight. Sit down in a chair, keep your spine straight. I sit down in this called your kneeling stool. Most of you have seen. If not, let me show it to you one more time. I have it, few of them, and I use it all the time, especially if I'm sitting in front of the computer. This is a kneeling stool. I'll sit down with my knees, with my hands in the level of the computer. So my back is always straight when I'm sitting down. And this is the thing people talks about now. They said, sitting kills, moving heals. And I always say, we have to sit down these days because all of our work in our computer, we are in the keyboard all the time. But learn how to sit with your spine straight, even sitting in front of the computer. Then follow your breath and listen to your body signal. Number one body signal is a pain. You do not want to put in a posture in your body which will cause pain. So do not practice yoga after taking a pain medication. Second, always activate the both sides of the brain. You notice what are the way I was sitting, I just changed my feet. I do it all the time. If you're right-handed, use your left hand. Health is defined in yoga as a balance of your body, mind, and spirit. Next is called the food shit to the breath shit. Any imbalance you create in the physical body, it will show up in your breath. Be sure your breath is effortless. So the primary objective of this practice is to bring a relaxation response in stages and meeting the patient and client where they are. It is non-competitive. Keep the spine straight. Listen to your body's signal. No pain, comfortable discomfort, and effortless breathing. First, you'll sit down. Hand is connected to your body and mind. Touch your index finger and thumb. This is called your Gano Mudra or Dhanu Mudra. If you're practicing with me, see if you can sit down, touch index finger and thumb, put it over your knees. Lung is like a balloon. It has 6 liter capacity. It needs 1.5 liter to keep it open, and it has a 4.5 liter which it can exchange. Normally, we only exchange 0.5 liter, 500 cc. So learn how to empty the balloon. Breathe out first. Take a deep breath in effortlessly. Breathe out longer than breathing in. Do not compete with anybody. Keep doing on your pace where you feel comfortable without any effort. Normally, we ask you to do between 5 to 10 breaths. When you're using 5 to 10 breaths, you bring the relaxation response, you bring the parasympathetic activation, and what happens to you, you develop a phenomena called neuroplasticity. And neuroplasticity basically is called a habit forming. Your habit is formed. Now that is the way you are going to do your sitting down breathing. So I'm sitting here. My brain is allowing me to sit like this. So after this breath, you practice it now if you want to. Breathing out longer than breathing in. Breathing out at least 1.5 times, if not 2. Very gently you can breathe in, count of 2 in, 1 and 2 in. Easily can breathe out, count of 4 out. 1 and 2 and a 3 and a 4 out. We've been doing so long, we can effortlessly do count of 6 in, count of 12 out, count of 8 in, count of 16 out, count of 10 in, count of 20 out. Let me show you just one example, how long we can do it. Let's do it count of 8 in, count of 16 out. It was count of 9 in, count of 18 out. I'm still talking, I'm breathing, I'm singing. That's called effortless breathing. I can breathe more than 3, 4, 5 times than the normal amount normally we breathe. Then sequentially we start relaxing our whole body. And this phenomena we learn from the babies. If you see a baby does all the yoga posture. Baby will get up into a cobra pose. They will do a downward facing dog. The hand, they will have a hand gesture called mudra. Babies will close the fist, thumb inside and close. This is called Balo Mushti Mudra or Adhi Mudra. When you do that, you'll see I have a saliva in my mouth. When you develop a saliva in your mouth, that means you are having parasympathetic activation, which is called calm and digest. When you get scared, your mouth becomes dry. That is a sympathetic phenomenon. So you can do your breathing. You put your hands like this. You breathe out first. Take a deep breath in. Breathing out, do a fist, yoga fist, a baby fist. And it will relax your hands. Breathe in, breathe out. Keep doing with me. You'll need to do it about 5 to 10 times. Wrist gets relaxed with the extension. Breathe in, breathe out. Breathe in, breathe out. I do with my eyes closed, so I follow my breath. Breathe in, breathe out. So this looks such a simple practices, but eventually with the practice, relaxation will set in. All the pain in the hand is due to tightness, the arthritis, all. So see, when a hand is tight, the finger doesn't go through, but relaxed, finger goes through very easily. You can turn your hands all the way you want. You got a carpal tunnel, pain in the wrist. So you put your hand here and just in steps, in stages, impossible become possible. Slowly, you'll be able to put your hand. When you're able to put your hand like this, you get a total relaxation of the wrist joint. It's a wonderful practice. Elbow. Elbow gets relaxed in internal rotation. Elbow gets tightened up with the external rotation. And that happens when you hit a ball, like external rotation, you develop a phenomenon called a tennis elbow. So more and more you do internal rotation, you'll be relaxed. You'll see we'll do a reverse prayer pose that will relax your elbows. Shoulder is a ball and socket joint. Put your hands here. Slowly bring your elbows together. If it doesn't come, wherever it comes, remember, you start where you are. You are not competing. Breathe out first. Take a deep breath in. Slowly rotate. Breathe in, breathe out. The reason I'm showing you these practices is that breathe in, breathe out. If you have a diabetes, if you have a coronary artery disease, if you have a hypertension, high cholesterol, all chronic lifestyle related disorders, our experience and our research shows, okay, keep doing opposite way, activating other side of the brain. Our experience and our research showed that there is a significant reduction of the pharmaceutical support. In some cases, their total withdrawal of the medication. So you don't do it on your own. You keep doing it. This is synergistic practice. You are taking antihypertensive medication, then go ahead and do the yoga practices. You go to see your doctor. Your doctor probably will see you every 6 months or a year. doctor will say, you know what? The blood pressure looks good. You know what we can do? We can see if we can cut down your medication. And if the practice continues, if it helps, they will, almost reduce your medication. Shoulder can be relaxed with the hands. You can put your hands high up, hold your one wrist, breathe out first, take a deep breath in, and pull it down behind your head. Same breathing cycle, bring it to the top. Breathe in, breathe out. I always show it to you because I do this practice every single day. So what I'm bringing here, I'm bringing the practice, what I do. Breathe in, breathe out. Same cycle I come here. Breathe in. Whole upper body get relaxed. It's called a prayer pose to the back. Reverse prayer pose is called Paschim Namaskar. So you see, let me show it to you when I'm turning into the back, and you will see how easy it is and how easily you can do it. Slowly bring your hands together, and wherever the hand is, if the hand is here, it's okay. If you can put it together, it's very nice. Sit down, keep your spine straight, do your breathing out longer than breathing in, and then put your hand in a prayer pose. So when you're able to do in a prayer pose, you stay in the pose. You stay in the pose again with your eyes closed, the spine straight, and do your breathing out longer than breathing in. In a day, you'd stay in there for 5 to 10 breaths, and in a short time, you'll see your hand will go high up a little bit more. Again, if you stay here, continue it. Remember, neuroplasticity will set in, and when the relaxation response sets in, parasympathetic activation sets in, your hand will go up a little bit more. Practice it daily. This chest opening poses is excellent for your underlying cardiovascular disorder. Our research, our echocardiogram shows that a chest opening poses increases your ejection fraction. Relaxation response helps in improving the preload of the heart. That means the amount of blood is getting returned into the heart, and the relaxation response will reduce afterload. For a heart function, increasing the preload, reducing the afterload, and improving the ejection fraction, many patients I've seen are able to reduce their medication, which is called a pharmaceutical support, and able to maintain a good quality life and able to prevent the progression of the disease and also reverse the disease. When you hear the blockage of the coronary arteries in the heart, you have a stent, angioplasty, you have a bypass. Then again, after a few years, it comes back. Same thing with the patient with cancer. You have a breast cancer, you get a surgery, radiation, chemotherapy, all therapy, everything is cured. After 5 years, 10 years, cancer comes back. Because the underlying condition is called oncogene. Gene has to express. Practice of yoga causes suppression of genetic expression. So wonderful practice. Say, I can hold my hand in the back for hours and hours because that's my relaxation response. I also progress slowly now. I was in a easy pose, Sukhasana. Now this is called your Siddhasana. Perfect pose. In stages, everything happens. Then to quiet down your body and mind, we practice a breathing technique called Bumblebee breathing, Brahmari Pranayama. Mind is the content of your five senses. I hear, I see, I smell, taste, and I touch. When I shut down my five senses, which is called Pratyahara, the fifth limb, and then my brain has a frequency, I create another frequency, two frequencies interact, cancel, it's called harmonic resonance. Always breathe through your nose. When you breathe through your nose, you breathe out first. When you breathe the air in, air gets filtered. Nose is like a personal air conditioner. The air gets all diverted through an area in the nose called a turbinate and goes directly into your larynx and the lung. If you breathe through your mouth, you have no idea where the air has gone in. It has gone in either in your lung or your stomach. Always practice with a smile in your face and always practice with a spine straight. Put your index finger in between the eyebrows. We call it the third eye. Use your three fingers to close your eyes. Use your thumb to close your ear. Breathe out first. Breathe through your nostril and breathe out with the sound of a bumblebee. Slowly take both of your hands, called thumbing and cupping. Keep rubbing your hands. When you feel the warmth in your hand, use the hand as like a cup. Put it over your eyes. Let the eyes take all the heat from your hand. Then you massage your forehead, massage your eyes, massage your face. This is called relaxation of the muscles. The muscles are attached to the skin. So all the frowning, all the lines, slowly goes away. Massage behind your ear, in front of the ear, external canal, earlobe. There is a branch called auricular branch of the vagus nerve, which causes parasympathetic activation. Bring your hand down, massage your carotid sinuses. The carotid sinuses relaxes your cardiovascular system, nervous system through a reflex arc activating vagus nerve. Hand to the back, massage to the insertion of your sternomastoid and trapezius muscle, which is supplied by cranial nerves to tame the cranial nerves. The neck is very tight, and we do a practice, the relaxation of the almost whole body. When you're able to do it, you will see it's wonderful practice. The neck is called a Brahma Mudra. You put your neck to the back and to the front and the side to side, then looking at the back and then turning around. But you do this with putting your hands to the back. It's called prayer pose to the back, Paschim Namaskar. You're in a chair, you can do it very nicely in a chair. You'll be breathing in, but in the time of breathing out, you will be incorporating the bumblebee breathing, and your exhalation will become longer and longer. The practice will be like this. Breathe out first. Take a deep breath in and put your neck to the back. Breathe out to the sound of a bumblebee. Then do it side to side. Again, breathe out first. Head is in the middle. Breathe in. Look all the way to the back. Now slowly rotate your neck to the left, to the back, to the right, then right to the back to the left. Generally, I do between 5 to 10 in each when I have a time. I'm just showing it to you. Just keep doing it. And you will see you'll be able to do it during all the time of the day. Breathe out first. Deep breath in. When your body is relaxed like this, what you feed your whole body, like I said, back pain. Back pain is due to the tightness of the muscles. See, we have a herniated disc, we have a spinal stenosis, all causes your back pain. But basically, it's irritation of a nerve and tightness of the muscle. So as you know, in acute pain, when you give a pain medication, even doesn't work. What it works at the time is a muscle relaxant. So here I am putting my feet up. This is called your half lotus. And I'm also putting it in stages, so I don't have any pain. I don't have any unusual symptoms. One of the unusual symptoms is, I hear it from a lot of people, is when you sit down like that, you got a little numbness of your toes and feet. So even if it is not pain, it's a sensation, and respect your body's sensation. That means you back off. All this discussion about yoga injury, all because you don't pay attention to your body's signal. The moment you listen to your body's signal, if you're doing all the work, all the exercises behind your breath, you won't be able to hurt yourself. I do a treadmill. When I do treadmill, I'm walking, I'm running, I'm always behind my breath. See, huffing, puffing doesn't help in healing. Huffing, puffing is a hypoxia. It helps in your building your strength, building your stamina. But healing only takes place when you do it in stages and in sequence. Now see, I'm relaxed enough. I can put my 1 foot high up and I can sit down. This is called your, very simply, Padmasana or a lotus pose. When you have this sensation of lightness and relaxation, you'll see they call it Tadasana. You can put your hand on the side and, or maybe you can put your fist on the side and you will be able to get your body high up and raise high up. And you can stay high up. You don't feel too much often. Like when you see the hands are relaxed, fingers will be separated. Hands are tight, fingers will be close together. Same way as your toes. When you look at the toes, you have a separation of the finger toes. This is called your relaxation response. When the toes are separated. So in the market is full of it. Yoga toes, yoga socks, yoga shoes, but all are being designed to separate the toes. So I'll put my fingers there. Generally I do it after my shower. I'll put a little bit of a maybe skin lotion and I'll go both sides. So you can do it also. Relax your lower part of the body. Keep your body, this is called a Dandasana. Keep your spine straight, hand on the side. Separate your toes, breathe in, breathe out. The reason I'm showing it to you that I do it every single day. I let all my friends and families do it every single day, and most of them are either off medication and do not take any medication. Relax your ankle, breathe in, breathe out. Remember, hold your body strength, body weight is carried by your ankle. Breathe in, breathe out. We're all talking about hip joint and knee joint. Hip joint and knee joint just transmits your body weight. The whole body weight is carried by your ankle. And always do breathing. Breathe in, breathe out. Slowly rotate. Breathe in, breathe out. When you practice, you keep doing it a little bit of a longer and longer. Our practice is we practice 25 minutes of asanas, 25 minutes of pranayamas, and 10 minutes of meditation. This is a very nice, we call it windshield wiper practice, very relaxation. Do your relaxation of your ankle and hips. Seated forward bend, push Chibuttanasana, powerful tool, put your hand wherever it is. If it goes, touches your toes, is great. Close your eyes, breathe out longer than breathing in, and let your body fall down on its own. Don't push yourself. Body will come down. In fact, hands will go all the way out. You could even clasp it. Try not to bend your knees. Knees remain straight. Try to look high up. Touching my head to the knee. Relax when you get up. Slowly put your hands together. Wonderful practice. Relax your knees and hip joints. Bring it up. Again, take your fingers, put it in between your toes. It's wonderful. Relax. I do it all the time. Sitting in a chair, I put my hand, relax my toes. All the pain in the foot goes away. Peripheral neuropathy gets better. Sensation comes back. Knee, bring it up. Breathe out first. Take a deep breath in. Breathe out. Slowly let it go down on its own. Don't push it down. If it is here, let it be here. Continue your practice of the breathing. This thing will happen. If it doesn't happen today, it will happen tomorrow. It will happen day after tomorrow sometime, because it happened to all of us. Knee is the site of fear, and hip is the site of emotion. So all the emotion-related disorder, fear-related disorder. What fear? Stress. Stress is the fear of unknown. You know, when you first time give a talk in a public, what you had? You had a shaking knee, but after a while, it goes away. That is called vaccination. So we also call yoga therapy is a vaccination against your chronic lifestyle-related disorders. Isn't it a powerful statement? You do a vaccine against COVID-19, vaccine against infectious diseases, and these are called endogenous disease, and you have a vaccine against your endogenous diseases. So again, here is your knee, bring it up, breathe out first, and slowly it goes down to the ground. Breathe in, breathe out. Keep doing it, keep practicing with me. You will see a wonder will happen to your body and mind. You think that looks simple? Now we have all the parameters. This is our Apple Watch. I can record a EKG, I can record my heart rate, and I can do all my physiological function when I'm practicing. So we are telling you from a scientific data. So hip joint is the site of emotion, and number one emotion-related disorder today is your hypertension. You go to your kid's room, your blood pressure goes high up. Your boss starts screaming at you, your blood pressure goes high up. To put your feet together, bring it as close as possible. Keep your spine straight, hands there. Close your eyes and do your breathing, and still both the knees will come down slowly. Emotion-related disorders are all neuropsychiatric disorders. We call them Vata-related disorders. Vata people, when getting out of balance, become very anxious, but they're very creative. Pitta people, when they're out of balance, they become angry, but they're very focused, very determined. Kapha people are very contented. They have a lot of attachment. Your whole body get relaxed. It's a wonderful experience that you do. And if you do this much of this, you'll be amazed. Your whole body is completely relaxed. You can even feel your parasympathetic activation. See, you did it through, you do it through like a Ujjayi Pranayama. You get a cough when you do Ujjayi Pranayama. You do a little bit of Bhastrika Pranayama, Kapalbhati, Anulom Vilom, alternate nostril breathing. It becomes part of your daily practice. So once you are completely relaxed, you sit down it is your squatting pose, Malasana. Malasana, put your hands together and extend it. This is the way you get relaxed. Put your one elbow inside, other elbow inside. Slowly bring your hands close to you. Keep your spine straight, eyes closed. Keep doing breathing, breathing out longer than breathing in. This is a guaranteed, we call it a money back guarantee position. All the chronic lifestyle related disorders will say, let me get out of this body. I don't need to be here. Then scientifically described a yoga posture. It is called a sit-rise test. When you're able to get up without a support from sitting down, your every function system of the body, including cardiovascular system, becomes a totally functional system. In fact, this is a marker of your health. So normally you create a balance. I'm comfortable standing like this, the feet. So say, put your feet together. Put your feet together. Keep your body straight. This is called your Tadasana, or called a Dandasana, Jashthyasana. Stick your ear, your shoulder, your hips and ankle in the same line. If you put your hands high up, it will look like you are straight on the same plane. Now what you will do, you will see, you cross your feet. Crossing feet, if you see if you can sit down on the ground and able to get up without a support. Just these simple practices, we can tell you that yoga therapy instead of medicine. Cross on the opposite side. Always balance yourself. Go all the way down and all the way up. When you're able to do it, finally what will happen, you will be able to transfer yourself up from the ground without a support. That time will tell you that your functional level, functional capability, able to fight any chronic lifestyle related disorders and able to reduce pharmaceutical support is at your max practice. But remember, this is a daily routine. It is your lifestyle. You have to do it daily. There is no shortcut. Here I am, cross here, I'm in the ground. Slowly I can get up without a support. The moment you put up one hand, you lose 25% of your health. Two hands, lose 50%. So I'm in the opposite side now. Cross my feet. I'm always balancing myself all the way to the ground. From here, slowly you get up without a support. You do little pranayama practice, which we'll do every day, but I'll show you now in another session. Kapalbhati Pranayama, you don't do any pranayama with standing up. You do pranayama only sitting down or laying down. Kapalbhati Pranayama tells you to relax. Now, I'm right-handed, right-footed, and my hand always protects me from falling down. Put my hand in a prayer pose to the back. See if I can stand on my left foot. 10 seconds, 20 seconds, 40 seconds. 1 second, 40 seconds, then I see if I can close my eyes, I can stand on my one foot. By the time you do this, your money back guarantee, your medication support will come down. Balance it to the opposite side, the right foot. Again, Try it. Initially, you may have to hold on to a chair or a wall. After 40 seconds, you're able to do it. Close your eyes. Everybody asks me, evidence-based medicine. Yes, it is evidence-based medicine. This is also called a practice-based evidence. Karo yog, raho nirog. Keep doing yoga, you will be disease-free, you'll be healthy. You'll transform from a disease-ridden body to a healthy body to a yogic body. So even from here, you can do it very simply. You can do a tree pose. And when you do a tree pose with a hand to the back, it feels a little different than putting a hand in the front. And even from here, you can do a Kapalbhati Pranayama to see how you relax. To the opposite side. Finally, you do an inversion, put your head below your heart. When you put your head below your heart, pressure inside the brain goes high up, pressure inside the eye goes high up, and pressure inside the carotid artery goes high up. But if you keep it up, keep it down, slowly and slowly, you develop called baroreceptor sensitivity. When a baroreceptor sensitivity takes place, your pressure inside the brain comes down, pressure inside the eyes comes down, pressure inside the carotid arteries comes down, and what happens, you get a protection against sudden rise in the heart rate or a blood pressure. So we take, after heart problem, a beta blocker, ACE inhibitor. This thing functions as a beta blocker. Relaxation response acts as a, like your ACE inhibitor. So put your feet on both sides, keep separating. This is the Sanskrit name called Prasharito Uttanasana. Separated. Then you can slowly put your head down. For us, head will come all the way down to the ground. Then you do a Kapalbhati Pranayama here. And when you do that, you feel a profound level of relaxation. These are the simple practices you do for your whole, as I said, yoga therapy instead of medicine. Then also we do a setup of your pranayama. When you do a setup of your pranayama, and we have done it, and we'll do another session, it's a pranayama, doing a pranayama, your yoga therapy instead of medicine. One of the most important practices in yoga is called sleeping like a baby, sleeping like a yogi. The stress is causing all the lifestyle related disorders. Stress is in the area of the brain called emotional brain, limbic system. Two nuclei, amygdala, hippocampus. It sends a signal to the hypothalamus. Hypothalamus sends a signal to your autonomic nervous system and also to your pituitary gland. Sympathetic overdrive, cortisol secretion, and all this thing is due to your insomnia and sleep apnea. Sleep apnea is called fear of unknown. So when you sleep, who sleeps better? Babies. So sleep like a baby, and let me show it to you what you need to do, if you can sleep like this, which I do it all the time, so I'm going to share with you that how to sleep like a baby and how to sleep like a yogi. The first, you sleep like a baby. Have you ever seen how the baby sleeps? Look even a newborn, how the baby sleeps. So you lay down in your bed. Let's see if you can see. And if you need to put a pillow, you put a pillow just to be sure your chin is below your forehead. Don't stick your head high up. This is a very sympathetic response. Hands both sides, palm facing high up. Then if you see a baby, baby will put the feet together and sleep like this. This is called Supta Baddha Konasana, laying down, closed ankle pose. From here now you'll breathe like a baby. If you say baby, baby does abdominal breathing. Abdominal breathing is relaxation. Chest breathing is improving function of your lung. Breathe out first. When you breathe in, you will see abdominal wall will rise high up. Breathe out, it will come down. Breathe in. Breathe out. Keep doing it when you are laying down in the bed. I generally do it between 15 to 20. Then I do about 5 to 10 times, breathing out longer than breathing in. I do a breathing in for the count of 5 in and breathe out count of 10 out. Be sure one time, then you can practice on your own when you are on your bed. I start sleeping like this all the time. So breathe out first. Breathe in with a count of 5 in. Breathe out with a count of 10 out. This is one time. I will do it between 5 to 10 times. Then I incorporate breath holding. When you have breath holding, you develop called CO2 narcosis. Carbon dioxide builds up, it puts you like a narcotics. I will breathe out first, breathe in with a count of 4 in, hold the breath for a count of 16, breathe out with a count of 8 out. 1:4:2. When you become more comfortable, I will increase it to count of 5 in, 20 hold, 10 out, 6 in, 24 hold, 12 out. Let me show you 2 of them so you will see what I mean. Breathe out first. Breathe in with a count of 4 in. Hold your breath for count of 16. Breathe out with a count of 8 out. We can increase your level of breathing. Now you breathe out first. Breathe in with a count of 5 in. Hold your breath, count of 20. Breathe out with a count of 10 out. All the baby falls sleeps like this. If you have any little discomfort, you can put a couple of pillows underneath. Then we sleep like a yogi. Yogis always sleep like a fetal position. Initially, they sleep on the right side. So I'm turning on my right side. They put their hand, or they put their one hand high up, put their head, and then they keep their breathing out longer than breathing in. Initially, body's core temperature is high. When you have a deep sleep, the body core temperature comes down. On this day, your left nostril is open, which is a cooling breathing, which balances the inner heat of your body. When you stay here for some time, then you switch it back for your final sleep. Will be sleeping on your left side. And that's why I've been sleeping for a long time, and I'm feeling wonderful. Initially, put your hand like this. You might have a little bit of a little numbness, discomfort in your hand, but slowly you will get over with it. It's a wonderful therapy for your thoracic outlet syndrome. Now the body core temperature is coming down. This will open up the right nostril. Right nostril is a heating. Surabhedi Pranayama, sympathetic, and body core temperature is in balance. I sleep this way whole night. Generally, the sleep has two components, what called REM, rapid eye movement, which is around 25%, and non-rapid eye movement, which is about 75%. Rapid eye movement, you get your sleep, you get a dream, and the mind is active. So when you're developing a dream in your sleep, the sleep is not deep sleep. Non-REM sleep, about 4 stages, stage 1, stage 2, stage 3, stage 4. Stage 2 and stage 3 and stage 4 is about 50% of the sleep. And that is the time when you get all the benefits of sleep. When you are waking up in the morning without any alarm, you straighten up your right foot, your hands there, slowly get up, and do not get up suddenly. Just stay here for a while, and then start your daily routine. And I have shown it to you, what you do, a daily routine, we call Dinacharya. First, you sit down in the squatting pose, Malasana, drink a glass of water. Then we have a first bowel movement, brush our teeth, tongue scraping, we use a jalneti. Do it all the time. And these yoga therapy, practicing relaxation response, activation of the parasympathetic tone, a daily lifestyle is called your Dinacharya, and it's a lifestyle medicine. If you keep on doing it, I'm guaranteed that all of our Western trained physician is learning it. And I get it all the time. They have some unusual diseases, and they'll call me. And when I guide them just with the simple, relaxation techniques, they feel wonderful. So this is a wonderful practice, yoga therapy instead of medicine. Let's finish it today. I'll come back again. I'll do a yoga therapy instead of medicine, using pranayama, using meditation. Thank you for joining this program. We'll see you again next Saturday.